Urologist Reveals 3 Secret Pressure Points for Stronger Morning Erections. After 60, gentlemen, let's have a frank conversation. If you're a man over 50, are you noticing that once reliable sign of youthful vigor isn't quite showing up like it used to in the mornings? Do you ever feel that quiet disappointment, as if you're losing a fundamental part of yourself? Now, most men simply chalk this up to getting older, an unavoidable decline. But what if I told you the primary culprit isn't your age, but something you can actually influence? In fact, a massive 2022 analysis published in the Journal of Urology looked at data from over 40,000 men. They discovered that poor blood flow, what we doctors call endothelial dysfunction, was a 60% more accurate predictor of declining erectile performance than a man's age alone. This isn't just data on a page. This is real life. I think of my patient, James, a wonderful 68-year-old retired teacher who felt his body was letting him down. But once we focused on supporting his circulation with a few simple daily habits, he told me he felt more confident and alive than he had in years. I'm Dr. Audrey Wells, and my commitment is to bring this science to you. Today I'm going to show you 3 specific pressure points backed by centuries of practice and 4 foundational vitamins that modern science confirms can help reactivate your body's natural power, starting today. All right, let's dive right into our first and perhaps most foundational pressure point. Pressure point number 1, the C of energy, also known as CV6. Now, what is this point? It's a very specific spot located on the midline of your body, about 2 finger widths directly below your belly button. For centuries, Eastern medicine has revered this area as a major reservoir of the body's vital life force, or qi. It's considered a gateway, a central hub for your physical energy and stamina. But here is a critical mistake so many men make. They hear about this point, and they just start poking around that general area below their navel. Sometimes they press far too hard, causing discomfort. Other times, they press too lightly, barely making an impact. This random, inconsistent pressure often leads to frustration, and they give up, thinking it doesn't work. The problem isn't the point, it's the application. The benefits are found in precision and consistency, not in force. Missing the therapeutic effect because of improper technique is a very common pitfall, and it's what prevents many from experiencing the real potential of this simple practice. So why is this specific spot so effective for men's vitality? Let's put this into the language of Western medicine, which is where my expertise lies. It comes down to 2 key functions: circulation and nerve stimulation. The area known as CV6 is located directly over a critical network of blood vessels and nerves that feed the entire pelvic basin. This region includes the iliac arteries, which are the main highways for blood flow to your reproductive organs. When you apply steady, intentional pressure to this point, you are performing a type of manual therapy. This stimulation encourages vasodilation, which is a fancy medical term for the widening of your blood vessels. Wider blood vessels mean more blood can flow through, more efficiently. Better blood flow is the absolute foundational requirement for healthy erectile function and overall pelvic health. It's not just about one moment of performance. It's about nourishing the entire system with the oxygen and nutrients it needs to stay healthy and responsive over the long term. And this isn't just theory. While this practice is rooted in ancient traditions, modern physiotherapy and medical science acknowledge its principles. Studies on manual abdominal therapy, published in journals like the Journal of Bodywork and Movement Therapies, have shown that targeted stimulation of specific abdominal areas can significantly improve local blood circulation and autonomic nerve response. One 2018 study, for example, demonstrated that patients who received regular abdominal massage over these key points showed measurable improvements in peripheral blood flow and reported a greater sense of well-being. This provides powerful, modern evidence that by stimulating this area, you are actively encouraging the physiological responses needed for optimal function. It bridges the gap between ancient wisdom and modern scientific understanding. To put it simply, think of this point, this sea of energy, as the main water valve for the entire lower half of your body. Over time, due to a sedentary lifestyle, stress, or just age, that valve can get a little stuck. It can become sluggish. The flow isn't as strong as it used to be. By applying gentle, consistent pressure to this spot each day, you are essentially helping to turn that valve back on. You're encouraging a steady, powerful stream of circulation to rush back into the area, nourishing the tissues and ensuring the system is primed and ready when you need it. It's a simple, daily maintenance task for your body's internal plumbing. So, how can you incorporate this into your routine safely and effectively? It's incredibly simple. I recommend doing this first thing in the morning, perhaps even before you get out of bed. Lie comfortably on your back. Take your index finger and your middle finger and place them together on that spot, about 2 finger widths below your belly button. Now apply firm but gentle downward pressure. It should be strong enough that you feel it, but it should never be painful. You can either hold that steady pressure or you can make very small, slow, circular motions. Do this for about 1 to 2 minutes. Breathe deeply and calmly while you do it. That's it. That's the entire exercise. The key here, above all else, is consistency. This was the very first step that my patient, James, the 68-year-old retired teacher I mentioned earlier, added to his morning routine. He was skeptical, of course, but he committed to it, and he discovered a great synergy, quite by accident. He found that if he drank a full glass of water right before doing it, the effect felt amplified. He said it felt like he was priming the pump. Hydrating first and then stimulating the area gave him a much more noticeable boost in his overall morning energy. It's a small tweak, but for him, that simple combination of hydration and stimulation made a world of difference in his confidence and vitality, and it could for you too. All right. Let's move on to our second pressure point, and this one might surprise you. Pressure point number 2, the gates of origin, also known as kidney 1. Now what is this, and where is it? This point is located on the sole of your foot. If you look at the bottom of your foot, it's in that little depression that forms just behind the ball of your foot when you curl your toes inward. It's right in the center, between the 2 main pads. In traditional medicine, this point is considered the very starting point of the kidney meridian, which is seen as the foundation of your body's constitutional energy and vitality. It's often referred to as a grounding point, but here is a critical mistake that almost every man I speak to makes. They completely and totally ignore their feet. They think that because their feet are so far away from the center of their body, from the action, so to speak, that they couldn't possibly have any significant impact on their core vitality or their sexual health. This is a massive missed opportunity. Men will spend hundreds of dollars on supplements and gadgets, but they overlook this incredibly powerful built-in tool that they have access to every single day for free. Dismissing the feet is dismissing a key part of your body's interconnected circulatory and nervous system. So why is this specific spot on the bottom of your foot so effective? From a modern physiological perspective, it's all about nerve endings and systemic circulation. The soles of your feet are one of the most nerve-dense areas of your entire body. When you stimulate the kidney 1 point, you're sending a powerful neurological signal up through your peripheral nervous system. This signal helps to regulate the autonomic nervous system, which controls your body's rest and digest functions, counteracting the effects of chronic stress. More importantly, this stimulation acts as a sort of call to action for your circulatory system. It helps to draw energy and blood flow downwards, away from a tense upper body and an overactive mind, and pulls it down into the lower extremities. By improving circulation in your feet and legs, you are, by extension, improving the overall blood flow throughout your entire lower body, including the pelvic region. Think of it as activating a secondary pump for your circulation, right at the base of your body. And this is not just theory or folklore. There is a strong scientific basis for this. The entire field of reflexology is built upon this principle. Furthermore, numerous studies in medical journals, like the Journal of Alternative and Complementary Medicine, have explored the effects of stimulating specific points on the feet. A comprehensive review published in 2019 analyzed several studies on foot reflexology and its impact on peripheral circulation. The researchers consistently found that applying pressure to specific zones on the feet led to a measurable increase in blood flow, not just locally, but also in other parts of the body. Participants also reported significant reductions in stress and anxiety levels. This provides powerful evidence that stimulating the kidney 1 point can have a real, systemic effect, helping to improve overall blood flow and calm the nervous system, both of which are critical factors for reliable performance and vitality. To put it simply, imagine your entire circulatory system is a large, flowing river. Sometimes, due to stress or inactivity, blockages and stagnant pools can form upstream in your head and chest. This point on your foot, the gates of origin, is like a sluice gate at the very end of that river. By opening that gate, by stimulating that point, you create a powerful downward pull. This pull helps to clear out the stagnation upstream and encourages the entire river to flow more freely, more powerfully, and more completely. You're improving the health of the entire system by ensuring the flow reaches its final destination. It gets the whole river moving again. So how do you do this correctly and safely? This one is incredibly easy to fit into your daily routine. My recommendation is to do it in the evening, while you're relaxing. Perhaps you're sitting on the couch, watching TV, or reading a book. Simply take one foot and place it over the opposite knee. Then use your thumb, or even a small massage ball or a golf ball if you have one, to apply firm, deep pressure to the kidney 1 point. Press into that depression and hold it, or make small, deep circles. You should feel a strong sensation, but it shouldn't be sharply painful. Massage each foot for about 1 to 2 minutes. That's all it takes. It's a simple, relaxing ritual to add to your evening wind down. This simple act was a game changer for my patient James. He added this to his routine right before bed, and he discovered a wonderful synergy. He told me, "Doctor, not only do I feel more grounded, but I've been sleeping better than I have in years." This is critical. Deep, restorative sleep is when your body produces key hormones, including testosterone, and repairs itself. By improving his sleep quality through this simple, relaxing foot massage, he was giving his body the prime opportunity it needed to restore its natural hormonal balance. It wasn't just about the direct stimulation of the point, it was about the cascade of positive effects that followed. He found that better sleep led to more morning energy, which in turn supported his overall sense of vitality. That simple act before bed. It improved his vitality by first improving his rest. It's a powerful lesson in how interconnected our bodies truly are. All right, we've covered the core of your body and the foundation. Now let's talk about our third and final pressure point, which acts as a powerful integrator for the entire system. Pressure point number 3, the urgent pulse, also known as spleen 6. So what is this point? This is a crucial junction point on your body. To find it, first locate that prominent bone on the inside of your ankle. From there, measure 4 of your own finger widths, straight up your leg, along the back of the shin bone. The spleen 6 point is right there. It's unique because it's not on a single meridian. It's the intersection point of 3 major energy pathways in the body: the spleen, the liver, and the kidney meridians. These 3 systems are all considered fundamentally important for reproductive health, hormonal balance, and overall vitality. But here's the critical mistake that many people make when they try to stimulate this point, because this spot can often be a little tender to the touch. Many people press too lightly. They're too timid with it. They feel that initial tenderness and they immediately back off, or they only hold the pressure for a few seconds. This is ineffective. To get the therapeutic benefit, you need to apply sustained, consistent pressure. You don't need to cause sharp pain, but you do need to be firm enough to engage the point properly. Simply brushing over it or giving it a light, hesitant touch won't create the physiological response we're looking for. It's a common pitfall that stems from a misunderstanding of how acupressure works. So why is this specific intersection point so powerful? From a physiological and medical standpoint, stimulating the spleen 6 point has a profound effect on the neurovascular systems of the lower body. This area is rich with cutaneous nerves that connect back to the spinal cord at the same levels that regulate the organs of the pelvic region. When you apply pressure here, you're sending a direct neurological signal to this control center. This signal can help to regulate blood flow to the reproductive and urinary systems, and it's also believed to help modulate hormonal balance. Because it influences the liver, kidney, and spleen systems simultaneously, it's considered a master point for anything related to pelvic health. It harmonizes the functions of these systems, ensuring they work together efficiently rather than in isolation. For men, this means better support for circulation, nerve function, and the hormonal environment necessary for healthy performance. And this isn't just an ancient theory. Modern science has taken a keen interest in the spleen 6 point, particularly for its role in pelvic health. Numerous acupressure and acupuncture studies have explored its effectiveness. A systematic review published in the journal Medicine in 2021 analyzed multiple clinical trials related to spleen 6 stimulation. The researchers concluded that stimulating this point has a significant regulatory effect on the neuroendocrine system, which is the complex network that links your brain to your hormones. They found consistent evidence that it can improve pelvic blood circulation and reduce inflammation. While much of the research has been focused on women's health, the physiological principles, improving blood flow, regulating nerve signals, and balancing hormones, are fundamentally crucial for men's vitality as well. This provides a strong scientific rationale for its use. To put it simply, think of the first 2 points we discussed as individual train lines. The Sea of Energy is the main line to the central city. The Gates of Origin is the line that brings power up from the countryside. This third point, the Urgent Pulse, is Grand Central Station. It's the central hub where all these critical lines intersect and coordinate. If the trains aren't running on time at Grand Central, the entire system gets backed up and becomes inefficient. By stimulating this point, you are acting as the station master, ensuring all the connections are made smoothly and that energy and circulation are distributed exactly where they need to go, on time. Keeping the trains running smoothly at this central station is essential for the health of the entire system. So, how do you do this correctly? It's very straightforward. You can do this while sitting in a chair. Place your foot on the opposite knee. First, find your inner ankle bone. Use the width of your own 4 fingers to measure up your leg from the top of that bone. Press your thumb firmly into the spot just behind your shin bone. You will likely feel a slight tenderness here, which is normal. Apply firm, consistent pressure. You can hold it steady or use a deep, slow massaging motion. Do this for 1 to 2 minutes on each leg. Remember to adjust the pressure to a level that is strong and effective, but not sharply painful. Breathe and relax into it. This point, when combined with the other 2, creates a powerful synergistic effect. It's about ensuring the entire system is activated. You're opening the main valve at the Sea of Energy. You're drawing power up from the Gates of Origin. And you're coordinating everything at the Urgent Pulse. Together, they form a complete circuit to support your body's natural vitality. Now, if you've learned something new about your own body in this section, if one of these points was an aha moment for you, do me a favor and comment on the word vitality below. It really helps me know that this information is valuable and is resonating with you. All right, we have just covered 3 powerful external techniques you can use to support your body's circulation and nerve function. Now, it is time to supercharge these external techniques with the right internal fuel. We need to create the optimal internal environment for your body to respond. And we do that by ensuring you have enough of 4 affordable, science-backed, foundational nutrients. These are not magic pills. They are the essential building blocks your body needs to perform at its best. Let's begin with the first nutrient, vitamin D, often called the sunshine vitamin. Now, the critical mistake so many men make with vitamin D is assuming they get enough. They think that a glass of fortified milk here and there, or a few minutes of occasional sun exposure, is sufficient. The hard truth is that vitamin D deficiency is incredibly, shockingly common, especially in older adults and in people who live in colder climates. It's one of the most frequent deficiencies I see in my practice, and most men are completely unaware of it. So, why is this vitamin so critical for male vitality? It plays a direct and vital role in the health of your blood vessel linings. We call this endothelial function. Healthy, flexible blood vessels are the key to strong circulation. When your vitamin D levels are low, your blood vessels can become stiff and less responsive, which directly impairs blood flow. Think of your blood vessels as flexible garden hoses. Without enough vitamin D, they start to become stiff and narrow, like old cracked hoses that can't deliver a strong, steady stream of water. And this isn't just a theory. A major 2020 study in the Journal of Clinical Endocrinology and Metabolism reaffirmed the strong link between vitamin D deficiency and an increased risk of erectile dysfunction. The science is very clear on this. So how do you get enough? The best way is through sensible sun exposure. About 15 to 20 minutes of morning sun on your arms and legs a few times a week without sunscreen. However, for many, that's not practical. In that case, talk to your doctor about getting your levels tested and consider a high-quality vitamin D3 supplement, especially during the winter months. A powerful synergy here is that vitamin D works hand in hand with our fourth nutrient, magnesium, which helps your body activate and use vitamin D effectively. Next up, we have the B vitamin complex, especially B6, B9, which is also called folate, and B12. The common mistake here is thinking of B vitamins only as energy vitamins. While they do help with energy metabolism, their most crucial role for our purposes is in protecting your nerve health. Healthy, responsive erections depend on lightning-fast, crystal-clear nerve signals traveling from your brain to your body. B vitamins are the protectors, the guardians, of these delicate nerve pathways. Think of your nerves like the electrical wiring in your house. B vitamins are the rubber insulation that protects those wires, preventing short circuits and ensuring the signals are strong and clear. The American Heart Association also notes that B vitamins help to reduce levels of an amino acid called homocysteine, which, when elevated, can damage the lining of your blood vessels. So how do you ensure you have enough? Eat more leafy greens like spinach, along with eggs and lean meats. A high-quality B-complex supplement can also be an excellent insurance policy. A great synergy for B vitamins is regular physical activity. Exercise boosts circulation, which delivers these crucial vitamins to your nerves more efficiently. Third on our list is a critical mineral for men, zinc. The mistake here is only associating zinc with fighting off a cold or boosting immunity, while completely ignoring its central role in male hormone production. Your body cannot produce adequate testosterone without sufficient zinc. It is a non-negotiable building block. And as you know, optimal testosterone levels are directly linked to a healthy libido and the quality of your erections. Think of it this way. If testosterone is the high-octane fuel for your libido and energy, then zinc is a key, irreplaceable ingredient required at the refinery to produce that fuel. No zinc, no fuel. Multiple studies, including a large review in the Journal of Reproduction and Infertility, have confirmed that zinc levels are significantly and directly correlated with testosterone levels in men. How do you get more zinc? Wonderful food sources include pumpkin seeds, beef, and chickpeas. A supplement can be helpful, but it's important not to exceed the recommended daily allowance without your doctor's guidance, as too much zinc can interfere with other mineral absorption. The best synergy for zinc is protein. Zinc is absorbed more effectively when consumed with a protein-rich meal. Finally, we have our fourth foundational nutrient, the powerhouse mineral, magnesium. The biggest mistake with magnesium is that it is almost completely overlooked. Most people are deficient in this mineral and have no idea. It's a quiet deficiency that can impact your entire body because magnesium is involved in over 300 essential bodily functions. For our purposes, its most important role is as a natural muscle relaxant. This includes the tiny, smooth muscles that line your blood vessels. Magnesium helps these blood vessels relax and open up, which allows blood to flow more freely and helps maintain healthy blood pressure. Think of your blood vessels as tiny muscles. Magnesium is the calming message from your brain that tells them to relax and open up, allowing blood to surge through. Research from esteemed institutions like Harvard Medical School continues to highlight magnesium's vital role in maintaining healthy blood pressure and nerve transmission, both of which are absolute cornerstones of healthy erectile function. To get more magnesium, incorporate foods like almonds, spinach, and avocados into your diet. A wonderfully relaxing way to absorb it is through an Epsom salt bath a couple of times a week. And as I mentioned, magnesium is the ultimate team player. It is the synergy for vitamin D helping your body to use it. It is the perfect end to our list. Now, was any of this surprising to you? Did you have an aha moment about one of these nutrients? If so, please comment on the word insight below. Your feedback truly helps me and our entire community learn together. So to quickly bring everything together today, we've uncovered the 3 powerful pressure points, the Sea of Energy, the Gates of Origin, and the Urgent Pulse. And we've paired them with the 4 foundational nutrients, vitamin D, the B vitamins, zinc, and magnesium. This was the exact simple protocol my patient, James, followed. And within just a few weeks, he returned to my office with a renewed spring in his step, telling me his confidence was back, not just in the bedroom, but in his life. But remember, knowledge without action is just entertainment. So here is your simple 3-step action plan for this week. I call it the Vitality Prescription. First, choose just one of the pressure points we discussed today and practice it for 2 minutes every single day. Just one. Don't try to do everything at once. Second, add just one food rich in one of these vitamins to your next grocery list. Whether it's a bag of almonds for magnesium or some pumpkin seeds for zinc, just start with one. And third, at your next regular doctor's appointment, be proactive. Ask your doctor about testing your vitamin D levels. Now, I know what some of you might be thinking. Doctor, I don't have time for this. The truth is, this entire routine takes less than 5 minutes a day. Or you might be thinking, this all seems too simple to actually work. And my answer to that is this. Real lasting change never comes from a single giant leap. It comes from small, consistent steps, repeated over time. This isn't about a magic fix. It's about consistently supporting your body's natural systems. So please trust the process. And remember why you're doing this. This isn't just about reclaiming your morning vigor. This is about reclaiming your sense of independence. It's about having the energy and the confidence to live your golden years to the absolute fullest. You deserve to feel strong, in control, and vital. Your future self is counting on the small choices you make today. So, if you are committed to making a change, no matter how small, I invite you to join our community of proactive men. Hit that subscribe button right now so you don't miss our future health guides. And more importantly, go down to the comments section right now and write 2 simple words. Day 1. This is your public commitment to yourself and to all of us. Let's support each other on this journey. Thank you so much for investing your valuable time with me today. In our next video, we're going to discuss the #1 food that could be quietly sabotaging your circulation without you even knowing it. You will not want to miss that one. Until then, stay strong, stay informed, and I'll see you in the next video.